Our immune system is supposed to protect our body from outside invaders. But what happens when it attacks the body instead? When the own body attacks itself? Sounds crazy, right? But it is possible. Autoimmune diseases are diseases where the immune system attacks the body. One kind of autoimmune disease is lupus. And the reason why lupus is so important to me is because I have lupus and I've had it since I was a baby. Up until 2 years ago, I thought I was a normal, average, healthy person. But in actuality, I had a disease that would flare up and wreak havoc in my body. Not a lot of people know about lupus, and most people go throughout their lives undiagnosed with lupus. Since my diagnosis, I have learned about the diagnosis process, the types of lupus, and the symptoms to look out for. To start off, I'd like to discuss the difficulty of diagnosing lupus. Lupus is an autoimmune disease that is very hard to diagnose. Rheumatologists are special doctors that can help diagnose patients with lupus. To be diagnosed, the main test a rheumatologist will require is an anti-nuclear antibody test, also known as an ANA test as stated by the CDC. This test is a blood test that shows the markers of the antibodies of lupus. Lupus can be hard to diagnose because it mimics other diseases. According to the Lupus Foundation of America, it can take up to 6 years for a patient to be diagnosed with lupus. The Lupus Foundation of America also states that 47% of people that have lupus get misdiagnosed with another disease. After diagnosis, you will have to learn the type of lupus that you have. Your rheumatologist can distinguish the type of lupus you have and the severity of it so that they can set up a treatment plan and medications. The first type of lupus your rheumatologist will see that you have is the systemic form of lupus. This type is known as systemic lupus erythematosus, also known as SLE as stated by the CDC, and it affects systems of the body. This type of lupus is the most common and dangerous type as it can damage organs like the kidneys, lungs, heart, and the brain. If you do not have the systemic form of lupus, your rheumatologist may check to see if you have the non-systemic form of lupus. This form has many types, as stated on the CDC's website. The form of non-systemic lupus that I have is cutaneous lupus erythematosus, developed from neonatal lupus that I developed as a baby that was misdiagnosed as jaundice. Neonatal lupus affects babies born with lupus that developed it from their mothers. Jaundice in babies, as the CDC states, is yellowing of the skin or eyes after birth. This is also a symptom of neonatal lupus. According to the CDC, cutaneous lupus can also affect SLE patients, but rarely affect systems of the body. Now that we know the types and some forms of lupus, here are some things to keep in mind. Women are most affected. Lupus does not affect everyone, and there are symptoms to watch out for. Women are the most affected by lupus. According to the CDC, about 9 out of 10 women are diagnosed with lupus between the ages of 15 and 44. The CDC also reports that African American are 3 times more likely than white women to be diagnosed. This also includes Hispanic, Native American, Asian, and Native Alaskan women. Symptoms of lupus need to be monitored and brought up to your doctor as soon as possible. The CDC's website on the symptoms of lupus contains a detailed list, and there are many. The most common forms are hair loss, rashes on the face that take the shape of a butterfly, muscle and joint pain, and extreme fatigue. The most important symptom to watch out for is kidney problems. As the CDC states, symptoms of kidney problems are weight gain, swollen ankles, high blood pressure, and low kidney function. Overall, lupus is a very serious autoimmune disease that people like me have to deal with day to day. Lupus was something that I was scared to bring up with my doctor, and it was something that was too outrageous for me to believe in. After my diagnosis, I feel much better about the diagnosis process, the types of lupus, and the symptoms to look out for. I'm not trying to scare anyone, but stay open-minded in your symptoms and bring it up with your doctor. Let them know what's going on so that you can get affirmations on your health. Be proactive today. Give people information about autoimmune diseases and lupus so that they can figure out what's going on with their bodies. Thank you.